When you do marketing, the number one goal of marketing is lead generation. That is the metric that you use to measure your marketing, okay? Now, it's not brand awareness, okay? Brand awareness is for like Oreos, okay? We don't do brand awareness in healthcare, okay? You're generating leads.
Welcome to the Healthcare Grind, formerly the Healthcare Hustle. We do what entrepreneurs often do and pivoted our podcast name in the first couple episodes because we realized someone else has that name, even though we did quite a bit of research. Oops. Regardless, this is still the podcast where we cut through the noise in the healthcare industry to bring you the latest trends, innovations, and insider insights. I'm Jess Harthcock, and I'm joined by my co-host, Lon Heck, as we embark on a journey to connect early-stage healthcare companies, payer executives, and investors with the knowledge and perspectives that matter most. Get ready to grind in the fast-paced realm of healthcare innovation. And for more advanced content, go to healthcaregrind.com.
Good morning, everyone. This is Lon Hecht from the Healthcare Grind. It's great to see you again. I'm joined by my great co-host, Jessica Harthcock. Jess, please say good morning to everyone.
Good morning.
And we have a great guest today, Dr. Erik Bricker. I'm really excited about this episode. Yep. Say good morning, Dr. Bricker.
Good morning, everybody.
All right. You all probably know, I love it too. You all know Dr. Bricker from LinkedIn and from YouTube and others. He is the one that does A Healthcare Z. He does fantastic topics and can really go deep on just about anything. So we're excited to have him as a guest today. And today we're going to focus on the employer market. So Dr. Bricker, if you don't mind jumping in, love if you could give everybody a little bit of a background about yourself.
Sure. So I am an internist. And believe it or not, I actually was a hospital finance consultant before going to medical school. So I was all in all the billing issues, et cetera, for hospitals prior to medical school, then went to medical school at the University of Illinois and then residency in Johns Hopkins in Baltimore. And I actually started a healthcare navigation firm called Compass Professional Health Services in my residency. I had to get special permission during residency to start a business. And then moved to Dallas where my business partners were. And then I actually practiced as a hospitalist because we actually bootstrapped the business. This was back in 2007, 2008 during the great financial crisis. So we couldn't raise any money. So we bootstrapped the business. We all kept our jobs and we grew that business to about 2,000 employer clients and about 1.8 million people. And as the chief medical officer, I actually was heavily involved. I ran sales and marketing and account management, like how to get and keep customers. So for over 11 years, I worked with employers and brokers and benefits consultants, and it was a fantastic experience. And we had clients from T-Mobile to like Joe's Plumbing and everything in between. And then we sold that business to Alight Solutions in 2018, and I started making these A Healthcare Z videos. So that's just a little bit about me.
That's some great background. The one thing I will say is I don't know if everyone realizes how incredibly rare it is to have a CMO that runs sales. That just doesn't happen. I've never heard that otherwise. Typically, I wouldn't put the two together in any way, shape, or form. Well, but it seems like it worked out really great for you. So congratulations on that and on the exit. So today we're going to focus on the employer market, and I'm going to kind of throw it over to you at a really high level and say, listen, we have a lot of listeners that are early stage entrepreneurs, and the employer market is always really attractive to sell into. And the one thing I like about the employer market is they tend to be able to make decisions a lot more rapidly than a payer would, right? Sure. So it's an area where you can get revenue much more rapidly than you would if you went the payer route. So I'd love to flip it over to you and just say, if you're that early stage entrepreneur, how do you think and get your head around this employer market? And how do you go to market and actually sell to employers? I know there are a million different channels you can do it. So I'll throw that softball over to you and see what you got for me.
Yeah. So it's a great question. And I would say in general for health, digital health startups, healthcare entrepreneurs, that really like 50, in my opinion, about 50% of your success is your actual value proposition, what I just kind of call your mousetrap, if you will. And the other 50% is really the sales, marketing, and distribution. Really is super important. And so, you kind of probably have heard of like the 4 Ps, like the product, the price, the placement, and the promotion, right? So we're talking about placement, which is really distribution, and then promotion, which is like sales and marketing. Like those 2 Ps, like it's 2 out of the 4 Ps, right? So you got to get those right. And so I think that one of the first things that a lot of entrepreneurs, in fact, I was literally on a call with an early stage, digital health company that sells to employers. And like, we literally talked about the value proposition for like 90% of the call. And I was just like, look, that fantastic, wonderful. It's not enough. Like, so like a number one thing is you got to understand the employer market, and you have to spend a lot of time on the employer market, right? So let's say you have 10 hours in a day. You're going to spend 5 of those hours on the employer market and sales and marketing and distribution. So like, you just if you're an entrepreneur, you're smart, you'll figure it out. Do not get distracted by your own value proposition and your own mousetrap, because frankly, it's not that exciting. Okay. Like, most people don't care. All right. So you really have to focus on the distribution. Okay. So fine. So the employer market is super important because it's super big. And so the number one rule in healthcare is that because the market is so big, you have to do what's referred to as market segmentation, right? You have to narrow the market down. To say that your market is everyone is to say that your market is no one. And so you really have to identify. The way you do that is by identifying what you refer to as your ideal client profile. Okay, so what is the ideal type of client for you? And so obviously, because there's a gazillion point solutions out there, let's just say you're a new point solution vendor for musculoskeletal or cancer or whatever, right? Part of your it's going to take a while for your solution to like clinically intervene with the person and like make them better, improve their outcome, lower their costs, all this wonderful stuff, right? So by definition, part of your ideal client profile means that the employer that you're working with needs to have low turnover. Okay, so the average turnover for a company in America is about 8 to 12%. But believe me, if you work with convenience stores, their turnover can be like 80%. Okay, and if you work with like a manufacturing or municipalities or school systems, their turnover can be like 2%. So by definition, you want to identify, okay, what is your ideal client profile? And then think about, okay, from an employer standpoint, what niche within the employer market fits that ideal client profile? Okay, that's super helpful, because when you're working with employers, obviously, they generally make decisions in conjunction with a broker or benefit consultant. And the insurance carrier world and the broker and benefit consultant world, it generally stratifies by employer size. And they call them jumbos, large group, middle market, and small group. And just rough hand-waving numbers is jumbo are like more than 50,000 lives. Large group is like 5,000 to 50,000. Middle market is like 100 to 5,000. And then small group is under 100. Some people use different delineations, et cetera. But in general, there's kind of four markets there. Okay. And that's super important, because the types of consultants that work with each one of those tends to be very specific, and they're mirrored by their counterpart at the insurance carrier. So the insurance carrier has account managers for small group and for mid-market and for large accounts and for jumbos or national accounts or whatever you call them. And so you have to understand that those are different types of broker personas that you're going to be doing channel sales through. So let's say you've got your ideal client profile and you're like, hey, it really is going to be low turnover employers like manufacturing and municipalities and school systems, right? That's it. Okay. Well, you can have a small school that has, like a private school that has like 50 employees. You could have a school system with like 5,000 employees. You could have a university with 75,000 employees or 50,000 employees, right? So that type of ideal client profile is then going to segment across the sort of different sizes. And so then you need to, and I could go on literally for over an hour about this, but I'll just kind of stop with this. And that is that when you're working with employers, it's important to use what is referred to as a push through and a pull through strategy. And this is actually used in the pharmaceutical world, right? Where what you're doing is you're taking your mousetrap, your value proposition, and you have to push it through the channel, i.e. the broker benefit consultant, but then you need to pull it through the end customer as well. So you need to do your marketing and your sales actually to both. It's not a one versus the other. It's actually both. In the pharmaceutical world, they do things to the doctor, and then they do the direct ads to the consumer as well, right? So it's both. Right. And so just know that you have to have an approach. So like in terms of like lead generation, you have to have a broker consultant lead generation process, but then you also need to have an employer lead generation process. So understanding those basic concepts. And there's more basic concepts, but I'll just pause there and say those are some big rock basic concepts that you need to understand.
That's great. Go ahead, Jess.
Yeah. So I had a question about the broker consultant piece. So if I'm an early stage entrepreneur, I'm wanting to get into this. You laid out a fantastic process to kind of say, here's the map, so to speak, of how I go about it. Who are the big broker consultants that I need to go to have a conversation with? And how do I approach them? Considering I have a strong value proposition, I know my pitch. What's the easiest way to kind of aggregate those people together? Is it individual conversations? Talk to me a little bit about that.
And what's the value to them? Can I add that on there? I'd love to understand what the value is to them.
And really what both of you are getting at, which in my opinion is super important that often gets lost, is that frankly, at the end of the day, it's sales and marketing tactics that are super important. Okay. So you could talk about all this like strategy stuff. I'm like, dude, if like you don't know the basic fundamentals and the tactics and like execute around that, you're totally hosed. Right. And if you actually do the tactics really well, it makes up for a bunch of bad strategy, So like literally, like you need to identify, okay, who are the, let's say, consultants for jumbos? Okay, let's start there. And generally those consultants for jumbos are, there's really 4 agencies, right? So there's Aon, there's Willis Towers Watson, and it's really Towers Watson, okay? Because Willis bought Towers Watson, but it's really the Towers Watson folks that do the jumbos. Okay. So even though they're the same organization, they're still Legacy Willis and Legacy Towers Watson. And so just know that if you're talking to a Legacy Willis person, they're not kind of the jumbo consultant from the Tower side. And then the last one is Mercer. Okay. Now the fourth one is an outlier for public entities like states and unions, and that's called Siegel. Okay, so those are the big 4. Like you need to know those names. Okay, then you go down to like the next group for like large group. You still have those 4 names that I just mentioned, but then there's sort of the next tier of broker consultants that also operate in that space. And that tier includes Lockton, Alliant, Arthur Gallagher, USI. You might put some other regional brokerages and consulting firms in there like Holmes Murphy. Okay. And there you have sort of that area. The best way to tactically get this list is you go to the Business Insurance Magazine website and they do a list of the 100 largest brokerages every year by revenue. And it breaks it down because all brokerages do both employee benefits and property casualty. And it breaks down their revenue by benefits revenue and property casualty revenue. And you just go through and you create a list. And you're like, oh, there's actually a huge brokerage in Texas called Higginbotham. Who's ever heard of Higginbotham, right? But they have a ton of business, right? And so you want to know it. Texas is like the size of Canada and Australia. It's a huge market, right? So like if you want to do business in Texas, you need to know who Higginbotham is. Okay, so tactically, you've got to know who these people are. And then literally you do things like you use LinkedIn or you buy lists or whatever to like identify who these people are. John and Jane and Mary and Steve. You need to literally like find out who these people are. And then the value to them really as a non-carrier entity, as a non-PBM entity, as a non-mainstream product entity, because they're used to dealing with, dental and vision and group life and short-term disability and long-term disability. And then you're kind of all this other stuff, random stuff. And frankly, this is another huge rock of understanding that you need to have. And that is referred to as the technology adoption lifecycle, which is that people are going to self-segment into early adopters, pragmatists, conservatives, and skeptics. And that holds true for broker consultants and for the employers themselves. And I kind of think of it like celebrities and their dogs. Like the dog of a celebrity kind of looks like the celebrity. Like Paris Hilton's got this like little thing that she carries in her purse, right? And then like somebody else has got like a huge German Shepherd, right? And so if you want to find early adopter employers, then typically they have more of an early adopter broker consultant. And so those early adopter, now I just want to tell you right now, there's no like sign on their forehead that says, hey, I'm an early adopter, right? But just within every single one of those firms that I just told you about, there are conservative, there are early adopter consultants and brokers. There's pragmatist consultants and brokers. There's conservatives and there's skeptics. Okay, so within each office, within the New York City office, within the Chicago office, within the Atlanta office, it doesn't matter what office they're in. And so your job as somebody who's new is to identify, okay, well, who are the early adopter broker consultants and who are the early adopter employers that might be interested in some sort of like outside thing that requires a separate implementation and a separate contract and separate reporting. I mean, you got to understand that HR generally doesn't like things that are separate. They want things that are all together. That's one of the huge advantages that carriers have over separate entrepreneurs is that most folks just like to push the easy button and just be like, I'm just going to get everything from Blue Cross. Frankly, I don't want to deal with all of this other muckety muck. And so, but if you can identify early adopters, then they're just frankly going to be more open to what it is that you do. Anyway, the punchline, Lon, to your question is that your value to a broker consultant is that the employer comes to them and be like, look, we got problems. In fact, I heard this. I just spoke to a broker. They kind of do groups like 2,000 to like 20,000. So broker consultant, and they're like, look, after 2023. Our employers are fighting mad. I'm like, they're actually kind of pissed because 2023 was not a good year for them financially. And they had high costs and claims and trend, and it was not good. And I'm going to the carrier, and frankly, the carrier doesn't have a lot of good answers for me. So I'm kind of in a pickle. I got to do something because I got a customer who's asking me to do something, and I don't know what to do. And that's when you ride in on your white horse and are like, hey, we've got XYZ solution for you. And so that the value is that the broker consultant needs tools in their toolbox to solve individual client problems. And you can be that tool in their toolbox they didn't know that they had before. That's going to then, bring value to their customer and, frankly, strengthen their relationship, allow them to win new business, et cetera, et cetera. So that's really the value that you bring to that broker consultant.
Gotcha. So that's great feedback. So there's so much we can cover here. And in a minute, we can kind of pivot over to the employer to talk about them a little bit. But back to the broker consultant for a minute. How do you engage with them? I mean, who are you engaging with at these broker consultants to actually get some traction to be able to sell your solution to the employer?
Yeah. So
can you help our audience understand that?
Great question. So in the big picture, the employees within a brokerage consulting firm tend to segment into two broad categories. And those are sort of the producer and the account manager. And so the producer tends to be the more senior person. Sometimes they're not called producers, they're called the lead consultant or what have you, but you have somebody who's more senior, more involved in the strategy. And then you have like the doer, the more tactical person who does like the implementation and the ongoing servicing of the account. And that's the account manager. And typically they work together in teams. So there'll be like one or two like strategy people. And then depending upon the size of the account, it might be one strategy person and one account manager, or it might be one strategy person and two account managers, etc. Now, you want to approach them both, okay? Because every single account employer, if you will, is different in terms of who really runs the show, okay? Because there are some relationships with some employers where that quote unquote producer or strategy consultant person is really the one who's the trusted advisor. And so you really need to get in good with them from a sales perspective. But there's others that are like, yeah, this guy comes in once a year and takes me out golfing and, we go on our duck hunt and whatever. And then he goes away and I never see him again. Right. And that they don't really listen to that guy. Okay. Right. But they're like, but the account manager, man, she is talking to us every week and she knows exactly what's going on with our company and she solves problems like it's nobody's business. She is so good at that. Man, do I trust her. And so you really need to get in with her because if you don't get in with her, you'll never sell into the account. So don't say, well, we're just going to approach the producer. Oh, we're just going to approach. You really need to approach both. So then you need to identify literally. And so this is where, when it comes to business sales in general and really employer sales for healthcare solutions specifically, it really comes down to lead generation. Okay. So when you do marketing, The number one goal of marketing is lead generation. That is the metric that you use to measure your marketing. Okay. Now, it's not brand awareness. Okay. Brand awareness is for like Oreos. Okay. We don't do brand awareness in healthcare. Okay. You're generating leads. Okay. Now, the number one way to generate leads is through outbound prospecting. So you can go to conferences and you can have webinars and all sorts of stuff. But at the end of the day, it is through outbound outreach through the form of phone calls, emails, and LinkedIn messages. Okay. You can even send them hard copy mail in like FedEx packages. Okay. So you have to like, one, you get a list. You have to create a list. I have always been a fan of creating the list myself because I have found that purchasing lists is highly inaccurate. The lists are outdated. They stink. And so I generate my own list. So at Compass, I would get up at 5, and from 5 to 7 every day, you can do searches. Okay. I want people in Atlanta. Who work for USI, and you can look up all the people in Atlanta that work for USI, and you can Joe and Jane and Steve and Mary. Okay. You got to literally get their names, and then you know that their email address is first.last at blah, blah, blah.com. And so you then reverse engineer into all their email addresses. And I spent 2 hours every morning to develop literally tens of thousands. Okay. It's not 5. It's not 50. It's not 100. This is a numbers game. Okay. You need to approach not 1,000, tens of thousands of these people. Okay. And if you get a 1% response rate and your goal is to get your call to action for them, right? Is I just want to get on the phone for 10 minutes. It is not a 30-minute webinar. It is not an hour-long webinar. Ain't nobody on the planet going to give you that. Okay. It is, I just want 10 minutes on the phone. And you don't even want to do, like, if you want to do face-to-face, that's fine. A lot of these people are doing it while they're driving in their car. Okay. So they don't necessarily want to be like on video with you. But if you can catch them like between meetings, that's actually preferable because the kind of brokers and consultants that you want to talk to are so busy talking to customers that they don't have time to talk to you. You actually want those people. Okay. But if you can get them in the parking lot or in the car, then that's super. You just want a 10-minute conversation. Okay. Now we can get into the details of like what that 10-minute conversation needs to look like. But that whole process of like identifying these people, approaching them and getting them on the phone for 10 minutes, like that's literally half the battle. Okay. So you can talk about like your slide deck and objection handling and all that sort of stuff. But to a certain extent, just having tons of leads and tons of 10-minute conversations can literally like win the game for you. You can win just doing that.
Got it.
That is great advice. And what I'm hearing is that, I mean, that's just grit. Boil it down to what it is.
Grinding. You're absolutely right. It's just grinding.
100%. And that's what I think some people, they want that easy button to, find that list, or I'm going to make a list of 25 people I'm going to reach out to. I mean, you just told us you reached out to tens of thousands of people. Yep. And every day you spend at least 2 hours trying to get to these people. That is great advice. I wanted to emphasize that because that's a big takeaway that I'm listening to.
So thanks, Jess. I'll jump in and say one thing because I want to pivot over in a minute over to actually direct to employer. So kind of to put a bow on this, we could talk about this topic all day long. And I'll say this for probably most listeners, especially those at a really early stage, this sounds like a really daunting task, right? This sounds like a lot. So I kind of want to put a bow on this and say, do you need to compensate these employer brokers? Do you want to talk about that for just a minute to give them an understanding of how they kind of make money in there? And then let's talk about the employer.
That's a great question. And the short answer is, as in most things in healthcare, is it depends.
Right.
Okay. So a lot of the early adopter, so the way that the compensation structure is set up between the actual broker consultant and the employer is that sometimes they are 100% paid just by the employer. It's like they charge them per hour or per project or whatever, and they're actually not interested in any compensation from you. Some of them have a fee arrangement such that they can get commissions from various places. Like they'll get commission from their major medical, they could get commission from dental and vision, up to a max amount of reimbursement total. Like we're going to get $15 PEPM from you. If you put all of the commissions from all these different things together, it's going to max out at $15 PEPM. And then other folks are just, straight commission. Now with the CAA that was passed, there's more transparency that the brokers need to tell their employer customers about where they're getting all of their commissions for. So the short answer is that it's important to have a flexible commission strategy such that in certain situations, you absolutely want to pay the broker consultant, and in other situations, it's not a big deal and they're not going to want compensation.
Okay, thank you. That's really helpful. So when I think about the employer market, I think of, you've got the broker consultants, you have the employer, and then you have the health plan, right? And they all kind of play their role in some way, shape, or form. Let's talk about the employer for a quick minute here. When you have, let's say, an innovative new solution, and a lot of these early stage companies are just looking for some traction for some initial customer. Going to a broker consultant, like I said, that may be daunting. That may be something that's like, wow, I want to do that, but man, that's like step 3 or 4, and I need step 1. So who would they be reaching out to in a typical employer? Who are the ones that make the decisions on bringing these early stage innovative companies in?
Yeah, so typically employee benefits, the budgeting for that runs under the HR department. Okay, so it's really important to understand how HR works at these companies. And again, it's part of the reason why you have jumbo, large group, mid-market, and small group, because that kind of defines what the HR benefits department looks like. So in a jumbo, in like Walmart, they literally have like 40 people that just work in benefits. I mean, it's like huge, because they spent $1 billion a year on it. They're not going to have one person running $1 billion budget for the company. They're going to have a whole team of people doing that, right? And so they've got strategy people and implementation people, and it's this huge hierarchy just within their benefits department. Whereas at your typical, let's say at large group, right, 5,000 to 50,000, like I'll say it's like 5 people. You'll have usually a VP or a director of comp and benefits, or sometimes they're called total rewards. And then underneath them, you'll have like 1 or 2 like benefits managers. And then underneath that, you're going to have benefits specialists. So when you're looking for job titles on LinkedIn to scrape from when you're creating your own list, you want to look for, the head of total rewards, head of comp and benefits, benefits manager, and then benefits specialist. And again, you want to approach all of those people because you don't know the power structure within that organization. There are some organizations where the benefits manager has been there for 25 years. And frankly, the head of total rewards, it's like a revolving door. And that person has only been in that position for 2 years. And they just keep having somebody new every 2 years. And so the person who really runs benefits is the benefits manager who's been there for 20 years. Okay, but you don't know. You can't tell that by looking at their LinkedIn profile. It's super hard, right? Okay, so when you are just starting out, and then when you get to a group that is, mid-market, that's where you get into a combination of both fully insured and self-funded employers. Okay, we are not going to get into the detail about what a self-funded employer versus a fully insured employer is today, but just know that those companies will have anywhere from like 1 to maybe 2 or 3 people working in their benefits department, so it's super small. And then for small group under 100, they typically have like 1 HR person who's doing everything. They're doing recruiting, they're doing compliance, they're doing the health insurance plan. So they're doing payroll. You got to understand, the most important function that any person in HR does is payroll. Okay, so getting paid is the most important function that they serve. Okay, so within that, if you are just starting out and you are brand spanking new, at the end of the day, I will say that 95% of HR people or departments are not going to be willing to go with any sort of new vendor or startup. So if you're super new, you actually should not approach HR. You actually need to approach the business owner because they're the only person who has enough clout within the organization where they can take a risk on you. And if you fail, they're like, I own the business. What are you going to do? Fire me? Right?
So when you say the business owner, you legitimately mean the business owner.
Like, the CEO or whatever, and it could have a variety of ownership structures such that the CEO reports to a board or whatever. But at the end of the day, there are many companies who have been super innovative in healthcare where the CEO has taken the bull by the horns and they have led the initiative. But as a new startup, let me just tell you right now, it's super hard to get to CEOs. So and this is why, listen, at Compass, we started in the mid-market. We started with groups 2,000 and below. Because there's no way you're going to be able to get in touch with a CEO of a 10,000 person company. It's just not going to happen unless you're like family friends and they used to change your diapers. Okay. But like, besides that, like if you're going to actually get in touch with a CEO, then it needs to be frankly for a smaller company. So don't like, if you can get the CEO of a 200 employee company to like be interested in what you do, awesome. Like take it. Okay. So you can definitely approach CEOs in the beginning. And I wouldn't even say CFO. I would really say CEO, because it's not only a financial decision, but it impacts the lives of the employees. And
Right.
the only person who really has the clout to be able to do that within an organization is really the CEO.
Okay, that's great insight. Jess, did you have a question on this? I was going to say we could pivot over to the health insurance side in a minute, but go ahead.
I have one more question. Thanks, Lon. So, you talked about kind of where is the easiest place to start. I know it probably depends on the solution that you're offering to that employer group, but you mentioned you started at the, 2,000 or less
Yep.
employee.
Yep.
So is that the best place for a startup to kind of start in your opinion, or are there other factors that they need to think about?
So yes, and they are highly relationship driven. And so because we were a bootstrapped company, we did not have friends in high places. And so there are definitely healthcare startups that have investors who are friends in high places. And probably the classic example of this is Hinge Health. Okay, so if you want to look at the rubric for a highly successful digital health company, it would be Hinge Health, because their lead investor was Bessemer. And Bessemer, the guy at Bessemer who invested in them, is a gentleman by the name of John Krantz. And John Krantz knows everybody. Okay, so he's one of the healthcare guys. Or Castlight had Venrock as their investor. Okay, and the people at Venrock know everybody. Okay, so, and same thing with Nava Health, it was Welsh Carson, and the guy at Welsh Carson knew everybody. Okay,
and Dr. Bricker, you're talking to 2X Nava Health people here, right?
I know, that's why I brought him up. I mean, awesome. The Nava Health story is perfect. If you have somebody, if you can get an investor who knows everybody to a certain extent, that might need to be your strategy. Okay,
yeah, strategic is very important.
Yeah, and so the world of employee benefits and healthcare and health insurance is hugely relationship driven. Okay, again, so many founders are so enamored with their value proposition. Believe me, no one cares about your value proposition. Okay, but they care about who you know. Okay, so the digital health world is filled with mediocre solutions that were hugely financially successful because of the relationships of who they knew. And frankly, the number one person in America for that is Bill Frist. Okay, so if you look to see if you know Bill Frist in any way, he's the kingmaker. He's the Simon Cowell of digital health. Okay, so if you somehow you live in Tennessee, go look somebody up, move to Tennessee, track this guy down. Okay, but it's hugely relationship driven. Okay, and so just know that if you do have relationships, then of course you can use those relationships to frankly go the carrier route. There's a lot of digital health companies that are screw employers, screw brokers. We can go the health plan carrier route because we've got the connection cachet to do it. And if so, by all means, do it. But if you're a bootstrapped company, do not even try, because there's no way you're going to do it.
Well, you bring up a good point, and that's the health plan. Where do they fit in all of this, right? So you mentioned something before, fully insured versus self-insured. I do think we need to come back to that in a second and have you give literally 30 seconds on each what it is. We don't need to go deep, just so our audience understands. We've talked about it a little bit in previous episodes. But when you think about the health plan, a lot of them have ASO contracts with employers, right? Or self-insured employers. So if you go to them and get a contract, you have the ability for them to push that out and act as a sales team for you with their employer customers. So can you talk about, first of all, real quick, high level, self-insured, fully insured, and then how does the health plan fit into this whole game with employers, and where would you focus for that?
Yep. So it's a great topic. So a fully insured employer tends to have less than 200 employees. So it tends to be your smaller employer groups. And when you're fully insured, the company is paying premium to a health insurance company, Blue Cross United, Cigna, Aetna. And the health insurance company is then actually taking the risk for the health care for the employees and their family members. So they're getting bills from St. Jude and St. Thomas and St. Elizabeth. They're getting bills from all the doctors and all the hospitals. And then they're paying out claims based upon the premiums that they get in. And just using, rough round numbers, it's about $12,000 per employee on the plan per year. So you never need to ask an employer, hey, what's your healthcare spend? just be like, hey, how many employees are on your plan? And that's important because if they have part-time employees, they will not put them on the plan because they don't have to, right? So you want to ask how many employees are on the plan and be like, okay, just take that number, multiply it by 12,000. And that's about how much they're spending on their, medical and pharmacy over the course of 12 months. So the last thing there that you need to understand is that fully insured employers have what is referred to as the medical loss ratio, such that the insurance carrier needs to pay out 85% of that premium. So if they get in $1 million of premium, they need to pay out $850,000 of that premium in claims. So really the financial and so there's actually very little competition for fully insured groups. So they can kind of shop it and switch carriers or whatever. But really the goal of an insurance carrier with a fully insured group is actually to have their healthcare costs go up so that they can slowly increase the premiums, because 15% is what they get to keep. So they want 15% of a larger number. They don't want 15% of a smaller number. Okay, so they want that number. Now,
people really need to listen to this. This is really important, right. And I don't think people understand this. This is incredibly. Everybody thinks everyone wants to save money, but no. Dr. Bricker's talking about something a little different here. So go for it. Repeat it again.
It's
worth repeating.
It's like they definitely, what they want to do is they want to have the premium go up by just enough that the employer will accept it and not try to shop it to another carrier. And shopping it, and there's a gazillion tactics that they use to prevent you from shopping it to another carrier. We won't get into that. Okay, but like, literally 90% of the time, they stay with the same carrier. So the carrier's job is to try to ratchet up their healthcare costs just enough so that they can keep being, okay, I get 15% of $1 million. I get 15% of $1.2 million. I get 15% of $1.4 million. That's what they're trying to accomplish.
Great.
Now, can I move on to self-funded?
I was just going to say, let's switch to self-funded.
Yeah,
because
so in a self-funded employer, yep. It actually it's less expensive for the employer to be self-funded, where when you're self-funded, you're still using an insurance company and giving people like insurance cards. So all the employees still get a card that says Blue Cross, United, Cigna, Aetna on it. And the employee has no idea if the company is self-insured or not. To them, it's the same. They go to the doctor, they go to the hospital, a bill is sent. Who cares? But what happens with a self-funded employer is that the health insurance carrier is only providing what you described as ASO, administrative services only. And that means that the carrier is providing the network, they're administering the claims, but they are not taking the risk. In other words, when the doctor and the hospital are paid, the carrier is actually wiring money from the employer's bank account to pay the doctor, to pay the hospital. So it's very different in that in an ASO relationship, the carrier is not taking financial risk. It's borne by the employer. Now, the employer can go out and buy what's referred to as stop loss insurance, and there's aggregate and specific stop loss, and you need to understand that as well. But the reason why this is important for healthcare startups to understand is because generally they like to go after self-funded employers, because self-funded employers can more directly recoup the savings from higher quality, lower cost care, because it's the employer themselves that are paying out the claims and are taking the risk, whereas the fully insured employer is not. And with that, I'll pause.
That's great. Any initial thoughts, Jess, or do you want me to jump in?
No, that's fantastic. I feel like people need to rewind that and listen to it again because of what you just laid out and how important that is to understand. That's great.
So then when it comes to, once again, being an entrepreneur and selling in here, if you're selling into the health plan side of the business, you can sell for their fully insured business, but you can also go after their self-insured or ASO business, right? So can you talk for a minute, Dr. Bricker, and we'll wrap up the episode in just a couple of minutes, but will you talk a little bit about, you've got the payer or the health insurer, you have the employer, you have the broker consultant. If you're trying to sell ultimately, what is your end game? So I'll go back and I won't name the employer, but I worked for a telemedicine company, right? Mm-hmm. And we had deals with insurance plans where basically an insurance plan would get a price from us. They would typically maybe add something on that, and they would sell that forward to employers. But then broker consultants who were involved would get some money on that as well for being involved in the process. Can you tell us how that whole game works? There's so much going on there. I just want to make sure an early stage entrepreneur can kind of think about this in a broader, like, big picture.
That's right. So it's very important to understand, and this happens in all industries. This is not a unique to healthcare or health insurance dynamic. It's very important that ultimately you as the startup, blah, 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 like ultimately, sometimes you'll hear like it's really B to B to C, right? Because ultimately your end quote unquote consumer is the plan member. It's the patient who's actually using your service. Okay. So it's essentially channel sales to get to that end person. It's two channels, right? So you've got the broker health plan channel that you got to get through. And then you've got the HR department channel that you got to get through to ultimately get to the end patient that you're trying to interact with. And this holds true, like if you are selling an energy drink, right, you have to pay the grocery store to get good shelf space. Okay. So the point is that in health insurance and in healthcare, it's the same way. The channel, i.e. the grocery store, needs to make money. Okay. They have to. So your financial model needs to involve how can you remunerate the channel. Okay. Now, historically, that has been kept quiet from the actual employer themselves. So the brokers and the carriers were making all this money selling shelf space to all types of vendors, and they never told their employer customer that. And that is slowly changing. Nothing in healthcare happens fast, but that is slowly changing. And here's what's interesting, is actually the feedback from, because I talk to employers and brokers all the time still, is that actually employers understand that and actually don't have a problem with the broker consultant or the carrier getting paid. They actually don't have a problem with that. I think it's important for them to know. And I think the employer would say that too. Yeah, we want to know. But I think that it is perfectly reasonable to have that approach and have it be known. That's totally fine, because unless that channel can now they either make money off of it via revenue or via equity. So the carriers own equity. So the other poster child so you might be in the employer space, great. If you're not in the employer space and you're in like Medicare or Medicare Advantage or Medicaid or whatever, then really the poster child there is called CareBridge. Okay. And CareBridge, the investors in CareBridge are United Health Group, CVS Aetna, Cigna, and Anthem. They own equity in the solution that they are promoting through. So they're going to make money when that equity is realized through an acquisition or an IPO. So they're financially motivated to distribute CareBridge because they're going to get paid on the back end because they own equity in it. Okay. So it's super important to know that it's either through, actual cash that they're going to be getting paid or through equity. That's just how the distributors, that's how it works.
Yep. Very helpful. And the carriers are strategic. So it makes sense that would take place. There are so many things that we could go into and dig deeper in on here. I think we're going to wrap up right around now. The one thing I do want to point out, I think is important for folks to understand, when you talk to health plans, most people talk about a per member per month fee. The one thing I do want to call out, and that's a charge you're charging for each member that's a part of the plan. When you talk about employees, it's per employee per month. So that includes them and typically their dependents. So it could be, one employer, I'm trying to say this right, a PEPM, even though you're charging one fee, it may cover anywhere from 1 to 4, 5, 6, 7 dependents. So it's really important that you understand that when you're out there talking to a carrier, that PMPM and PEPM are not the same thing. And if you are charging the same thing that you want on a PMPM for a PEPM, your margins are going to get crushed. You need to know that. So you got to go in with your eyes wide open. So anyway, Dr. Bricker, fantastic episode, very helpful. Can you do me a favor? Can you let the audience know what are the best ways to get in touch with you? And first thing I'll say is, anyone that is not subscribing, you're nuts. You've got to subscribe to his YouTube channel, and you've got to follow him on LinkedIn. But what other areas or other ways can folks get in touch with you?
Yeah, that's really the best thing to do. Thank you for that. Is if you just go on LinkedIn and just search Erik Bricker. I don't think there's too many Erik Brickers out there. So just connect with me on LinkedIn. And then if you are into YouTube, then go to A Healthcare Z, and I've got 450 healthcare finance educational videos. So it is super important for you to understand how this works. And again, focusing on your value proposition, frankly, needs to be decreased so that you can spend more time and attention on your go-to-market strategy. And that's what I'll leave you with.
Great advice. Thank you so much for a great episode. We appreciate it. Jess and I want to thank everyone for tuning in.
Thanks,
Have
Dr. Bricker.
Thank you.
Thanks, everybody.
Bye. As we wrap up this episode of the Healthcare Grind, we want to thank you, our incredible audience, for tuning in. If you found today's insights valuable, don't forget to hit subscribe and leave a review on your preferred podcast platform. Your feedback fuels our grind. For more exclusive content and updates, visit our website, healthcaregrind.com. Until next time, keep grinding, stay informed, and lead the charge in shaping the future of healthcare. This is Jess and Lon signing off from the Healthcare Grind.